All right, guys, this is the last chapter of this unit, and this one is going to be on the lymphatic system. This is very short. This is actually the second time that I'm recording this because my dogs interrupted me a time before, and I didn't realize that in pausing it, it was only pausing my movement of the screen instead of sound. So I was putting my dogs away. So hopefully we will get this one up and running, and I think that it was only like a 5-minute long. There's not very many slides here, but I do want to go over it. It is important. So let's start with the anatomy and physiology. There are lymph vessels, ducts, nodes. This is what protects our body from infection. It filters bacterial and non-bacterial products. It prevents waste products from entering our circulatory system, and it is heavily dependent on the vascular system, which is our blood flow. And lymph is clear fluid. So here's a good visual for you guys of the capillaries, blood capillaries and the lymph capillaries, and how they're kind of really close together, and how they depend, the lymph system depends on our blood for different, for it to carry out what it's going to do. There are two divisions here. The right lymphatic duct drains lymph from the head, the upper torso, and the right arm, and the left basically does the rest. There are some organs that are related to the lymph system: the tonsils, the thymus gland, the spleen, and the pineal gland. We can have different problems with this: enlarged lymph glands or nodes, fever, fatigue, weight loss, and most likely the diseases that we have in the lymphatic system are related to diseases of other systems. So lymphocytosis is just increased white blood cells. Lymphocytopenia is decreased white blood cells. They're going to check your CBC, which is just your white blood cell count, red blood cell count, those types of things. There is an x-ray that they can do, that they can inject dye, and they'll be able to see how the lymph system flows. They can do an MRI, biopsy, CAT scan. All right. So this is just talking about inflammation of the lymph glands. Remember, I talked about itis. I'm going to keep harping on that a little bit. That anytime you see itis, that just means inflammation. So we're going to talk about that there could be swelling, pain, tenderness. They're going to do a biopsy to confirm this. Here's another itis. This is swelling of the lymph vessels due to inflammation caused by strep or infections following trauma. This is characterized by a red streak at the entry and expands to the area of the lymph node. They're going to feel bad, essentially, and they're going to have a swollen, wherever this is at, it's going to be swollen. They're going to treat it with antibiotics, warm moist packs, and elevation of the affected area if possible. This is an abnormal collection of lymph fluid in the extremities, lymphedema. This is a very interesting one. I don't know if any of you have had this before. I had this when I hurt my leg in a mower accident, and I had lymphedema in the lower part of my leg. This was due to trauma for me, but they can be due to surgery, pregnancy, burns, radiation treatments. There's all sorts of things that can cause lymphedema. Treatments: antibiotics, compression therapy, surgical intervention sometimes if it gets really bad. For me, they just told me to elevate my leg, and I wore compression socks for a while. I still have problems with this, but usually if I wear some compression socks and put my leg up, it'll get better. Lymphoma is a neoplasm or a cancer affecting the lymphoid tissue. This affects normal lymphocyte production, which you should know by now that lymphocytes have to do with your white blood cells, and that can lead, and your white blood cells are what helps your immunity. So this can lead to impaired immunity. And at the time of the writing of this text, this was the most common type of blood cancer in the United States. Mono, we've touched on a little bit. This is a viral infection, also known as the kissing disease. Somewhat contagious. When I was in school, they talked about how it was very, very contagious. Kawasaki disease, you don't need to know about. It's not on your exam. I just left it in here because it's kind of interesting. It's a febrile or a fever disease that's found mostly in children. And they get a rash similar to scarlet fever, but their hands and their feet swell and they feel bad. There's not a lot they do for other than supportive treatment, treating them feeling bad, any kind of fever that they might have. And then we talk about, lastly, about the effects of aging. We get decreased ability to produce antibodies, thus we're more prone to infection. We're more susceptible to those autoimmune disorders that we've talked about in the previous chapters. And then our vascular system, which is our blood flow, impacts, the impairment to that is going to impact the function of this system. So if you have any questions about that, let me know. That's really all for this chapter. It's, like I said, it's a short chapter. There's not a lot in here. I try to touch on the things that you really need to know. So if there's something else that you have a question about or anything like that, please feel free to let me know.